Meet Sarah. She took Sotalol for her irregular heartbeat until one day she collapsed in her kitchen. What her doctor failed to mention: Sotalol isn't like other beta blockers. Today we're revealing the shocking side effects of Sotalol that every heart patient must know, and exactly how to stay safe. This isn't just medical advice. This could save your life. What is Sotalol? Sotalol, pronounced Sotalol, is a medication that helps prevent and treat fast or irregular heartbeats, also known as arrhythmias. One of the most common types it treats is atrial fibrillation, AFib, a condition where the upper chambers of your heart beat out of rhythm. To understand how it works, think of your heart like a drummer in a band. It needs to beat in a steady rhythm to keep everything running smoothly. But sometimes the drummer gets too fast or offbeat, and that throws everything out of sync. Sotalol helps calm the drummer down by slowing overactive electrical signals in the heart, bringing your heartbeat back to a normal rhythm. It also helps lower your heart rate so your heart doesn't have to work as hard. Sotalol belongs to a group of medications called antiarrhythmics. These are used specifically to help correct abnormal heart rhythms. Common brand names: Betapace, Betapacev, Serene. While it's mainly used for heart rhythm problems, it might be prescribed for other reasons too. So if you have any questions about why you're taking it, don't hesitate to ask your healthcare provider or pharmacist. They're there to help. What are the side effects of Sotalol? Like all medications, Sotalol can cause side effects. Some are more common and usually mild, while others can be more serious. Let's break it down in a way that's easier to digest. Common side effects. These are more likely to happen, especially when you first start the medication. Dizziness or lightheadedness. Your blood pressure or heart rate may drop a bit too much. Feeling tired or weak. Your heart is beating slower, so you might feel less energetic at first. Slow heartbeat. This is expected, but if it gets too slow, it can become a problem. Headache. Nausea or vomiting. Sleep problems. Trouble falling or staying asleep. Chest pain or palpitations. Feeling like your heart is skipping a beat or racing. Swelling in the legs or feet. Diarrhea. Rash or itching. Mental fog or confusion. Low blood pressure. Mood changes like anxiety or depression. More serious, but less common side effects. These can be dangerous and should be checked out right away. Severe breathing problems. Fainting. Irregular or very strong heartbeats, arrhythmias. New or worsening chest pain. Signs of heart failure, like swelling, shortness of breath, or sudden weight gain. A very specific dangerous rhythm called Torsades de Pointes. A potentially life-threatening heart rhythm, especially if you already have other heart issues. Peripheral vascular disorders. Poor circulation in your limbs. Impotence or sexual dysfunction. Increased insulin needs for people with diabetes. Withdrawal effects. Suddenly stopping the medication can cause your heart rhythm to get worse or become unstable. A quick note: not everyone experiences side effects, and many of them go away once your body adjusts to the medication. But if anything feels off, especially symptoms like chest pain, fainting, or trouble breathing, contact your doctor right away. Also, this list doesn't cover every single possible side effect. Always check in with your healthcare provider if you notice anything unusual. Tips for taking Sotalol Betapace. Sotalol is a powerful medication that helps control heart rhythm problems. But to keep things running smoothly, there are a few important things to know while you're on it. Stay on top of check-and tests. Sotalol isn't a set-it-and-forget-it type of medication. Your doctor may need to regularly check potassium levels, kidney function, heart rhythm and blood pressure. These checkups help them fine-tune your dose to keep you safe. Mark your calendar or set reminders for any blood work or follow-ups. Hospital stay at the start. If you're just starting or restarting Sotalol, you'll likely need to stay in the hospital for at least 3 days. This allows your care team to monitor your heart closely and find the right dose. Once you go home, continue with the exact same dose they prescribed. Don't adjust it on your own. Watch for dizziness or low blood pressure. Feeling dizzy, lightheaded, or unusually tired. Your blood pressure might be dripping too low. Here's what to do. Change positions slowly, especially when standing up. If you feel like you might faint, sit or lie down right away. Let your doctor know. They might need to adjust your dose. Tip: keeping a blood pressure log at home and bringing it to your appointments is super helpful. Diabetes. Check blood sugar often. Sotalol can make it harder to notice the usual warning signs of low blood sugar. Except sweating, that symptom usually stays. If you take insulin or other diabetes meds, talk to your provider about how often you should check your levels. Medication interactions matter. Sotalol doesn't always play nicely with other medications. Be sure to tell your provider about all medications or supplements you're using. Check before starting any new drug, even over-the-counter ones. Don't stop suddenly. Stopping Sotalol without medical advice can make your heart rhythm worse or cause other serious issues. If you feel like it's time to stop, work with your provider to gradually reduce your dose over 1 to 2 weeks. What if you miss a dose? Take it as soon as you remember. But skip it if it's almost time for your next one. Never double up, that could cause dangerous heart effects. Planning surgery. Let your surgeon and care team know you're on Sotalol. They'll guide you on whether to adjust your dose before the procedure. Summary: Sotalol can do wonders for your heart rhythm when taken correctly. Stick to the schedule. Keep your appointments. Communicate with your doctor. Your heart will thank you. If you're watching this, you're already taking control of your heart health. And that's incredible. While Sotalol can be challenging, remember, over 2 million people manage these side effects successfully every day. You're not alone.